It started with small things, mispronounced medical terms, hesitation during routine procedures, and always asking nurses to double-check his work. But when I found multiple fake identity documents in Dr. Martinez's locker and discovered he'd been impersonating physicians at 3 other hospitals, I realized our ER had been infiltrated by someone who could kill patients with his ignorance. My name is Monica Thompson, and I've been an emergency room nurse for 15 years at City General Hospital. In that time, I've worked alongside hundreds of doctors, from brilliant specialists to overconfident residents. I've learned to read people quickly, to spot competence and incompetence, confidence and fear. It's a survival skill in the ER, where split-second decisions can mean the difference between life and death. But I'd never encountered anything like Dr. Carlos Martinez. What started as suspicion about an inexperienced physician turned into the discovery of a fraud so elaborate and dangerous that it shook my faith in the entire medical system. This is the story of how careful observation, professional intuition, and refusing to ignore red flags exposed a fake doctor who had been practicing medicine without any training, putting countless lives at risk while hiding behind stolen credentials and forged documents. Dr. Carlos Martinez arrived at City General Hospital on a Monday morning in early September, introduced to our emergency department as a new attending physician with experience in trauma medicine. According to his paperwork, he'd completed his residency at a prestigious hospital in California and had been working in emergency medicine for 3 years. At first glance, Dr. Martinez seemed impressive. He was well-dressed, articulate, and carried himself with the confidence typical of emergency physicians. He had all the right credentials displayed in his hospital ID badge, and his introduction during the morning staff meeting was polished and professional. "I'm excited to join the team at City General," he announced to the assembled nurses and doctors. "I believe in collaborative medicine and look forward to working closely with the nursing staff to provide excellent patient care." As the senior black nurse in our ER, I'd heard similar introductions dozens of times from new doctors. What struck me as unusual was how general his comments were. Most experienced emergency physicians mentioned specific areas of expertise, previous challenging cases, or particular procedures they specialized in. Dr. Martinez spoke in the kind of broad terms you'd expect from someone reading from a script. But first impressions can be deceiving, and I decided to give him the benefit of the doubt. Some doctors were naturally more reserved, and it wasn't unusual for new staff to feel nervous during their first few days. That afternoon, Dr. Martinez was assigned to work alongside me during the busy day shift. Our first patient together was Mrs. Rodriguez, a 45-year-old woman who'd come to the ER with severe abdominal pain. "Doctor, Mrs. Rodriguez in room 3 needs evaluation for possible appendicitis," I reported, handing him her chart. Dr. Martinez took the chart and studied it for what seemed like an unusually long time. "Right, appendicitis. Remind me, which side is the appendix on again?" I stared at him, certain I'd misheard. "The right side, doctor." "Of course right side, I knew that. Just wanted to make sure you knew." He laughed nervously and headed toward the room 3. That should have been my first major red flag. Over the next few days, I began noticing a pattern of concerning behavior from Dr. Martinez. During patient examinations, he would frequently ask me to confirm basic findings or verify standard procedures that any emergency physician should know automatically. "Monica, when checking for appendicitis, we press on the right lower quadrant, correct?" he asked during Mrs. Rodriguez's examination. "Yes, doctor, McBurney's point." "Right, McBurney's point. And that's where exactly?" I showed him the anatomical location that every medical student learns in their first year. Mrs. Rodriguez looked confused by the exchange, but Dr. Martinez covered his lack of knowledge with jokes about teaching moments and keeping skills sharp. More concerning was his reluctance to perform procedures that should have been routine for an emergency physician. When a patient came in with a deep laceration requiring sutures, Dr. Martinez spent several minutes preparing while I set up the equipment. Monica, would you mind demonstrating the suturing technique? I want to observe your hospital's preferred method before I begin. In 15 years of nursing, I'd never been asked to demonstrate suturing to a doctor. Nurses assisted with procedures, but we didn't teach attending physicians basic medical techniques. Doctor, suturing techniques are pretty standard. Would you like me to get the department head to assist? No, that's not necessary. I'll handle it. But his hands shook as he picked up the needle, and his suturing technique was so poor that I had to intervene to prevent injury to the patient. Dr. Martinez, perhaps you'd like me to finish this procedure while you see the patient in room 7. He agreed quickly, clearly relieved to avoid continuing a procedure he obviously couldn't perform competently. By the end of Dr. Martinez's first week, I'd witnessed enough concerning incidents to know something was seriously wrong. He'd misdiagnosed a heart attack as indigestion, prescribed medication doses that I had to quietly correct, and consistently avoided any procedures more complex than taking blood pressure. I decided to investigate his background discreetly. During my lunch break, I used the hospital's computer system to review his employment file and credentials. Dr. Martinez's file contained all the expected documents: medical degree from Universidad Nacional in Mexico, residency completion certificate from Riverside Medical Center in California, medical license from the State Medical Board, and letters of recommendation from previous supervisors. Everything looked legitimate on the surface, but I'd learned to pay attention to details that others might miss. The formatting of his medical degree was slightly different from other international degrees I'd seen. The residency certificate had some typos that seemed unusual for an official document. And his medical license number, when I checked it against the state database, showed an active license for a doctor. Carlos Martinez, but the photo didn't match the man working in our ER. I took screenshots of these documents and began researching the institutions listed on his credentials. What I found was disturbing. Universidad Nacional in Mexico had no record of a Carlos Martinez graduating in the year listed on his degree. Riverside Medical Center in California confirmed they'd never had a resident by that name. The letters of recommendation were supposedly from doctors who, when I called their offices, claimed they'd never heard of Dr. Martinez. Dr. Carlos Martinez was practicing medicine in our emergency room with completely fabricated credentials. Armed with evidence that Dr. Martinez's credentials were fake, I faced a difficult decision. Reporting my suspicions to hospital administration would require proof beyond internet searches and phone calls. I needed concrete evidence that would be taken seriously by people who had approved his hiring in the first place. I decided to search his locker. Hospital policy allowed security searches of employee lockers under certain circumstances, but as a nurse, I didn't have official authority to conduct such a search. However, I did have legitimate reasons to be in the locker room during shift changes, and Dr. Martinez had been careless about securing his personal belongings. During the evening shift change, I noticed that Dr. Martinez's locker was slightly ajar. Inside, I could see what appeared to be multiple identification documents and medical certificates. I quickly photographed the contents with my cell phone. What I found exceeded my worst fears. Dr. Martinez had at least 4 different sets of identity documents, driver's licenses, social security cards, and medical licenses for Carlos Martinez, Miguel Santos, David Rodriguez, and Antonio Hernandez. Each set had different photos, but they were all clearly the same person using different identities. Most shocking were the medical certificates and hospital employment records, showing that this person had worked as a doctor at hospitals in Texas, Arizona, and Nevada under these various identities. He wasn't just a fake doctor at our hospital, he was a serial medical imposter who'd been moving from state to state, working in emergency rooms despite having no medical training. Among his documents was a notebook containing what appeared to be medical information copied from textbooks and websites. Basic anatomy diagrams, drug dosage charts, and step-by-step procedures for common emergency treatments were handwritten in simple language, as if someone was teaching himself medicine from scratch. As I reviewed the evidence I'd gathered, the full scope of Dr. Martinez's operation became clear. He'd developed a sophisticated system for creating false medical credentials and had been using it to work as a physician in hospitals across the southwestern United States. His method was brilliant in its simplicity. He targeted busy emergency departments where staff turnover was high and thorough background checks might be rushed. He presented himself as an experienced emergency physician looking for new opportunities, complete with fabricated credentials that looked legitimate to HR departments focused on filling critical positions quickly. Once hired, he relied on nursing staff to cover for his incompetence. He asked nurses to double-check his work, claimed to prefer collaborative medicine, and positioned his ignorance as thorough carefulness. In the high-stress environment of emergency medicine, his colleagues attributed his hesitation and mistakes to the adjustment period that all doctors experience when starting at a new hospital. Most disturbingly, I realized that Dr. Martinez had been learning medicine on the job, using real patients as his training cases. The notebook in his locker contained observations about procedures he'd watched other doctors perform, medications he'd seen prescribed, and symptoms he'd observed in patients. He was literally teaching himself to be a doctor by experimenting on people who trusted him with their lives. I knew I had to act quickly. Every day, Dr. Martinez continued practicing put more patients at risk. But I also knew that accusing a doctor of fraud without absolute proof could end my nursing career if I was wrong. I decided to confront him directly while recording the conversation on my phone. The opportunity came when Dr. Martinez made a serious medication error that I caught before it harmed the patient. He'd prescribed a drug combination that could have caused a fatal reaction, and when I questioned him about it, his response confirmed my worst suspicions. Dr. Martinez, this medication combination is contraindicated. It could cause severe cardiac complications. Oh, is it? I must have overlooked that. What would you recommend instead? A real emergency physician would never ask a nurse to recommend alternative medications for a serious condition. That question could only come from someone who had no idea what he was doing. Doctor, I think we should call in a cardiologist for consultation, I suggested, testing his response. Good idea. You handle that. I'll go check on other patients. As he walked away, I activated the recording app on my phone and followed him. Dr. Martinez, can I speak with you privately about Mrs. Johnson's case? We stepped into an empty supply room where I confronted him with what I'd discovered. Carlos, I know about the fake credentials. I know about the multiple identities. I know you're not a real doctor. His face went white, and for a moment he seemed ready to deny everything. Then his shoulders sagged in defeat. How did you find out? Your medical license number belongs to a different Carlos Martinez. Universidad Nacional has no record of you. Riverside Medical Center never trained you, and your locker is full of fake documents." He sat down heavily on a supply crate. "I never meant for anyone to get hurt." "People have gotten hurt, Carlos. You've been practicing medicine without any training. You could have killed someone." What followed was perhaps the most disturbing conversation of my nursing career. Carlos Martinez, whose real name was actually Manuel Gutierrez, told me how he'd developed his elaborate fraud. "I started as a hospital janitor in Houston," he explained. "I watched doctors work, listened to their conversations, learned medical terminology. I was smart and I picked things up quickly. But that doesn't qualify you to practice medicine. I know that now, but at the time I thought I could learn enough to help people. My family was poor, and being a doctor seemed like the only way to make enough money to support them." Manuel explained how he'd created his first fake medical degree using computer software and high-quality printing. When that got him hired at a small hospital in Texas, he realized how easy it was to fool hiring managers who were desperate to fill positions. "The first few months were terrifying," he admitted. "But the nurses were so helpful, and I watched other doctors constantly. I started to feel like I was actually learning to be a doctor." "But you weren't learning properly. You were putting patients at risk with every case you handled." "I told myself I was being careful. I never took cases that seemed too complicated, and I always asked for help when I wasn't sure about something." What Manuel didn't understand was that emergency medicine doesn't allow for the luxury of avoiding complicated cases. When patients came to our ER, they needed immediate, competent care, not someone learning medicine through trial and error. As Manuel continued his confession, the true scope of his deception became clear. Over 3 years, he'd worked in emergency departments in Texas, Arizona, Nevada, and now our hospital. He estimated that he'd treated over 2,000 patients while impersonating a physician. "Did any of those patients die because of your incompetence?" I asked. Manuel was quiet for a long time. "There were some cases where patients didn't recover as expected, but I don't know if that was because of anything I did wrong." The uncertainty in his voice suggested that he suspected his fake medical practice had cost lives, but he'd never allowed himself to fully acknowledge that possibility. "Manuel, you have to understand that every patient you treated was endangered by your fraud. Even if they didn't die, they deserved real medical care, not someone pretending to be a doctor." "I know that now. I've been thinking about stopping, finding a different way to support my family." "You can't stop on your own. Other hospitals need to know about this so they can review the cases you handled. Patients need to know so they can get proper follow-up care." Manuel looked terrified. "If this comes out, I'll go to prison. My family will lose everything. And if it doesn't come out, more patients will die from your incompetence." I gave Manuel an ultimatum. Confess to hospital administration immediately, or I would report him to authorities with the evidence I'd gathered. He begged for time to figure out how to tell his family, but I couldn't allow him to continue treating patients for even one more day. "Manuel, I'm going to Dr. Patterson's office right now to report what I've discovered. You can come with me and confess voluntarily, or I can report you as a fraud who's been discovered. Either way, this ends today." We walked together to the office of Dr. Patricia Patterson, our emergency department director. Manuel was shaking, but he'd agreed to confess rather than have me expose him. "Dr. Patterson," I began, "we have a serious situation that requires immediate attention. Dr. Martinez has something he needs to tell you." What followed was one of the most shocking conversations in City General Hospital's history. As Manuel confessed to his elaborate fraud, Dr. Patterson's expression shifted from confusion to disbelief to horror. You're telling me you've been practicing medicine in my emergency department for 3 weeks without any medical training? Yes, ma'am. I'm sorry. I never meant for anyone to get hurt. Dr. Patterson immediately activated the hospital's crisis management protocols. Security was called to escort Manuel from the building, all of his recent patient cases were flagged for review, and the medical board was notified of the fraud. The investigation that followed Manuel's confession revealed the full extent of the damage caused by his medical impersonation. Over 2,000 patients across 4 states had been treated by someone with no medical training, and dozens of cases required immediate follow-up care to correct his mistakes. 3 patients had died in cases where Manuel's incompetence may have contributed to their deaths. While it was impossible to prove definitively that proper medical care would have saved them, the families deserved to know that their loved ones had been treated by a fraud. Manuel was charged with multiple felonies, including fraud, impersonation of a physician, and endangering public safety. He was sentenced to 15 years in prison and ordered to pay restitution to affected patients and hospitals. City General Hospital faced lawsuits from patients and families who'd been harmed by Manuel's fake medical practice. The hospital implemented new verification procedures for checking medical credentials and background information, ensuring that such fraud couldn't happen again. Most importantly, the medical board created a national database for verifying physician credentials that made it much harder for medical imposters to move from state to state. I still work in the emergency department at City General Hospital, but the Manuel Gutierrez case changed how I approach my relationships with physicians. I learned that competence can't be assumed based on credentials alone, and that nursing staff have a responsibility to speak up when something seems wrong with a colleague's practice. The case also reinforced the importance of trusting professional instincts. The small signs that had bothered me about Dr. Martinez, mispronounced terms, hesitation during procedures, constant requests for verification, were all symptoms of someone operating far outside their competence level. But perhaps the most important lesson was about the vulnerability of our medical system to fraud. Hospitals under pressure to fill positions quickly can be susceptible to sophisticated deceptions, and patients trust us to ensure that the people treating them are qualified and competent. Manuel Gutierrez's case became a textbook example of medical fraud, studied in nursing schools and used to train hospital administrators about the importance of thorough credential verification. His fake medical practice put thousands of patients at risk and undermined trust in the healthcare system. 3 years later, I received a letter from Manuel in prison. He'd earned his GED and was studying to become a certified medical technician, a legitimate healthcare role that matched his actual level of education and training. "I want you to know that I understand now how wrong I was," he wrote. "I put people's lives at risk because I was too proud to admit I wasn't qualified to be a doctor. Thank you for stopping me before I killed someone." The letter was a reminder that behind every fraud case is a human being who made terrible choices, but it didn't change the fact that his deception had endangered thousands of innocent people who trusted him with their health and lives. Sometimes the most important nursing skill isn't administering medication or monitoring patients. Sometimes it's recognizing when something doesn't seem right and having the courage to investigate, even when that investigation reveals uncomfortable truths about people we work with every day. Because patients trust us not just to provide good care, but to ensure that everyone providing care is qualified to do so, and that trust is sacred.